NHS Cervical Screening Program, providing a quality colposcopy clinic. Okay, this particular part from part 2 MRCG point of view is little less important, but important from the part 3 point of view, especially in the audit aspect. This there can be questions from this particular topic. Hardly 3 to 4 slides are there. Okay, so the duty of candor. What does the duty of candor means? The duty of candor is a legal and ethical requirement in the healthcare, especially in the NHS UK. It means that healthcare professionals must be open, honest, and transparent with their patients when something goes wrong with their care. If the patient has suffered harm or if an error is discovered, that is, during an audit or review, the healthcare team must inform the patient truthfully about what has happened, explain the possible effects or consequences, offer an apology, and describe what steps are being taken to prevent it happening again. Okay, so sometimes it can happen because audit is going to be a very important part of the this cervical screening program or the colposcopy clinic management. And if you find the certain report, maybe name change is there and the report is misplaced or the wrong report is issued, and this has been found during the audit, you have to perform the duty of candor. Okay, so even sometimes in part 2 from the clinical governance module, they can ask you the question. Okay, so here the principle of duty of candor is there from the clinical governance. So you have to inform the patient truthfully about what has happened, explain the possible effects or consequences, offer an apology, and describe what steps are being taken to prevent it happening again. Okay, now there are certain things about the quality control in the colposcopy clinic. So training and continuing education. So how much should be the caseload, minimum caseload in the colposcopy clinic? I think more than 50 cases should be referred to the colposcopy every year. That means at least 4 to 5 cases in a month should be referred. Then recertification is required every 3 years by British Society of Colposcopy and Cervical Pathology. Okay, BSc PP certification is required every 3 years. Then CME. The CME should be attended by the staff. Okay, and quality assurance, regular audit, appraisal, and peer discussion should be there. Then key quality standards. The operational meetings should be every 3 months. These operational meetings are different from the MDT meetings. MDT meetings are multidisciplinary meetings. Operational meetings are of that particular colposcopy clinic. Okay, of that particular staff, they will be conducted every 3 months as a part of internal quality assurance. Biopsy result communication. More than 90% should be communicated to the patient within 4 weeks. 100% reports should be communicated to the patient within 8 weeks. Okay, and non-attendance. That means the colposcopy appointment is given, but the patients are not turning up. Then that particular attendance should be less than 10% for new patients and less than 15% for follow-up patients. Okay, non-attendance should be less than 15% for follow-up patients. That means they have attended the clinic previously, but in subsequent follow-up they are missing. That rate should be less than 15%. Okay, then colposcopic caseload, we have seen at least more than 15 new cases per year, and recertification is required every 3 years. Okay, then what advice is given in the colposcopy clinic after the treatment? That tampons and intercourse to be avoided for 4 weeks, swimming to be avoided for 2 weeks, driving is allowed unless advised otherwise. Okay, because anesthesia is not given. Then alcohol moderate use is allowed, exercise, light activities permitted, menstrual changes, temporary alteration is possible, and fertility, there is no effect on fertility. And if there is a deep excision more than 10 millimeter, there is an increased risk of mid-trimester miscarriage. So all these advice should be given in the colposcopy clinic. Okay, sometimes they can ask some SBA. So these particular figures you should remember. Tampon, intercourse, they have to be avoided for 4 weeks, swimming for 2 weeks. Okay, then what information and communication? Counseling must be part of colposcopy service. Provide written information before and after the procedure about the invitation, contact timings, etc. Results, we have seen more than results communication, 90% within 4 weeks, 100% within 8 weeks. Locally relevant leaflet should be provided, and use independent interpreter if required. Operational meetings every 3 monthly, and that will include the colposcopist, nurses, and administrative team. Then discuss about the policy, protocol issues, incidents, audits, risk, and quality gaps, chaired by the lead colposcopist. And these are separate from CSPL management meetings. Audit of invasive cervical cancer. Okay, so this particular audit, especially sometimes they can ask in part 3 but not in the part 2, but the aim is to understand causes of cervical cancer despite screening and monitor program performance. Okay, it has got an educational component, reviews management of each invasive cervical cancer case, mandatory participation of quality assurance, lead colposcopist, and CSPL, that is cervical screening program lead, ensure audit completion. Patients who develop cancer after screening are offered review of their screening history, and disclosure follows duty of candor guidelines. This we have already discussed what is the duty of candor. Okay, so in every invasive cancer, the case should be audited. Okay, there should be separate audit of invasive cervical cancer, because we would like to, in spite of having such a monitoring, such a good screening program, why there is a invasive cervical cancer.